Turner syndrome. It is named after Dr. Henry Turner, who discovered the syndrome in 1938. In 1964, it was determined to be due to a chromosomal abnormality. It is primary hypogonadism in phenotypic females that affects females. It's also called monosomy X, gonadal dysgenesis, and Bonneville-Ulrich syndrome. Turner syndrome occurs when part or all of one of your X chromosomes is missing. This condition affects approximately 1 in 2,000 females. Unlike other genetic conditions, it is not inherited from parents. Mother's age and environment has no any influence either. Rather, it occurs during formation of the reproductive cells in a parent or in early cell division during development. The entire X chromosome is found to be missing in 57% of patients, resulting in a 45X karyotype. If you have a look at karyotype, you can see that entire chromosome is missing. In mosaic individuals, cells with X monosomy, 45X, may occur along with cells that are normal 46XX, cells that have partial monosomies, or cells that have a Y chromosome 46XY. The presence of mosaicism is estimated to be relatively common in affected individuals in about 67 to 90%. In these cases, the symptoms are usually fewer and possibly none occur at all. Signs and symptoms of the following common symptoms of Turner syndrome. An individual may have any combination of symptoms and is unlikely to have all symptoms. Short stature, lymphedema, swelling of the hands and feet of a newborn, broad chest, shield chest, and widely spaced nipples, increased weight, obesity, webbed neck. Prenatal signs. Despite the excellent postnatal prognosis, 99% of Turner syndrome conceptions are thought to end in miscarriage or stillbirth, and as many as 15% of all spontaneous abortions have the 45X karyotype. Cardiovascular malformation. 17% to 45% of patients have cardiovascular malformations. Different karyotypes may have differing rates of cardiovascular malformations. The higher rate in the group of pure 45X monosomy is primarily due to a difference in the rate of aortic valve abnormalities and coarctation of the aorta, the two most common cardiovascular malformations. Congenital heart disease. Congenital obstructive lesions of the left side of the heart, leading to reduced flow on this side of the heart, has observed. This includes bicuspid aortic valve and coarctation, narrowing, of the aorta. Other congenital cardiovascular malformations, such as partial anomalous venous drainage and aortic valve stenosis or aortic regurgitation, are also more common in Turner syndrome than in the general population. Bicuspid aortic valve. Up to 15% of adults with Turner syndrome have bicuspid aortic valves, meaning only 2, instead of 3, parts to the valves in the main blood vessel leading from the heart are present. Since bicuspid valves are capable of regulating blood flow properly, this condition may go undetected without regular screening. However, bicuspid valves are more likely to deteriorate and later fail. Coarctation of the aorta. Between 5% and 10% of those born with Turner syndrome have coarctation of the aorta, which is a congenital narrowing of the descending aorta. It is usually just distal to the origin of the left subclavian artery and opposite to the ductus arteriosus. Normal skeletal development is inhibited due to a large variety of factors, mostly hormonal. The average height of a woman with Turner syndrome, in the absence of growth hormone treatment, is 140 cm. Women with Turner's mosaicism can reach normal average height. Due to inadequate production of estrogen, many of those with Turner syndrome develop osteoporosis. This can decrease height further, as well as exacerbate the curvature of the spine, possibly leading to scoliosis. About 1/3 of all women with Turner syndrome have one of 3 kidney abnormalities: a single, horseshoe-shaped kidney on one side of the body, an abnormal urine collecting system, poor blood flow to the kidneys. Some of these conditions can be corrected surgically. 1/3 of all women with Turner syndrome have a thyroid disorder. Usually it is hypothyroidism, specifically Hashimoto's thyroiditis. If detected, it can be easily treated with thyroid hormone supplements. Women with Turner syndrome are almost universally infertile. While some women with Turner syndrome have successfully become pregnant and carried their pregnancies to term, this is very rare and is generally limited to those women whose karyotypes are not 45X. Diagnosis: prenatal Turner syndrome may be diagnosed by amniocentesis or chorionic villus sampling during pregnancy. Usually, fetuses with Turner syndrome can be identified by abnormal ultrasound findings, for example heart defect, kidney abnormality, cystic hygroma, ascites. Postnatal. Often, it is diagnosed at birth due to heart problems, an unusually wide neck or swelling of the hands and feet. However, it is also common for it to go undiagnosed for several years, often until the girl reaches the age of puberty and fails to develop typically. In childhood, a short stature can be indicative of Turner syndrome. A test called a karyotype, also known as a chromosome analysis, analyzes the chromosomal composition of the individual. This is the test of choice to diagnose Turner syndrome. There is no cure for Turner syndrome, but therapies have been developed that can improve physical development. The primary therapies for affected individuals are growth hormone therapy and estrogen therapy. Individuals with Turner syndrome may benefit from growth hormone therapy, which can help to normalize height. Estrogen and progesterone replacement therapy will generally promote puberty and the development of secondary sexual characteristics. Modern reproductive technologies have also been used to help women with Turner syndrome become pregnant if they desire. For example, a donor egg can be used to create an embryo, which is carried by the Turner syndrome woman. Females with Turner syndrome and Y chromosome material Y chromosome mosaicism are at an increased risk of developing a tumor of the gonads. In such cases, it is recommended that the non-functioning gonadal tissue be removed. Additional treatment is symptomatic and supportive. For example, thyroid hormone replacement therapy may be used to treat individuals with thyroid disease. Correction of hearing loss with hearing aids is another important intervention, which can help with learning and social interaction.